This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. The first few moments of a newborn baby boy's life are filled with joy and wonder, and one of the first things a doctor does is a simple, gentle examination to make sure everything is where it should be. But what happens when something isn't? What happens when one or both testicles haven't completed their crucial journey down into the scrotum? This condition, known as cryptorchidism or an undescended testicle, is one of the most common congenital anomalies in boys. While it may sound like a minor issue, its management in the first months and years of life has profound implications for a man's future health, impacting everything from his fertility to his risk of developing testicular cancer. The way we approach this condition has evolved significantly, moving from watchful waiting and ineffective hormone treatments to a proactive, evidence-based surgical approach that prioritizes the long-term well-being of the child. Today, we're going to explore this common but misunderstood condition, guided by the best science we have to offer. So what exactly is cryptorchidism? Simply put, it is the absence of one or both testes from the scrotum. During fetal development, the testicles form high up in the abdomen near the kidneys. In the last couple of months of pregnancy, they begin a remarkable journey, descending through the abdomen and into the scrotum. Cryptorchidism occurs when this process is halted and a testicle gets stuck somewhere along that path. It's incredibly common, affecting about 3% of full-term baby boys and up to 30% of those born prematurely. It's important to distinguish a true undescended testicle from a retractile one. A retractile testis is a normal testicle that lives in the scrotum but can temporarily pull up into the groin due to a strong muscle reflex. A retractile testis does not require surgery, whereas a true undescended testicle does. The mechanism of testicular descent is a complex hormonal and mechanical symphony. Hormones like androgens and a key protein called insulin-like factor 3, or INSL3, act as the conductors, guiding the testicles downward. A failure in this hormonal signaling is one of the main reasons for cryptorchidism. The testicles are the body's sperm and testosterone factories, and they are designed to function at a temperature that is slightly cooler than the rest of the body. That's why they live outside the abdomen in the scrotum. When a testicle remains undescended, it's exposed to the higher core body temperature. This prolonged heat exposure is what damages the delicate germ cells that are responsible for producing sperm later in life. The goal of treatment is to move the testicle into its proper, cooler environment to protect these cells and preserve future fertility. The modern approach to managing cryptorchidism is built upon decades of research and is laid out in the 2014 American Urological Association guideline. This isn't based on old theories, it's based on a systematic review of the best available evidence. The cornerstone of the guideline is the understanding that spontaneous descent of a testicle after 6 months of age is very rare. The key proven intervention is a surgical procedure called an orchiopexy. The guideline makes a strong recommendation that orchiopexy should be performed between the ages of 6 and 18 months for boys with a testis that has not descended. This timeframe is not arbitrary. Studies have shown that performing surgery within this window offers the best chance of preserving testicular growth and fertility potential. In the past, hormonal therapy using HCG was sometimes tried, but the evidence is now clear that this is an ineffective treatment with a low success rate and potential side effects, and the guideline strongly recommends against its use. Despite the clear benefits of timely surgery, there can be delays in treatment. One reason is a lack of awareness among both parents and some primary care providers about the long-term risks of an untreated undescended testicle, which include infertility and a significantly increased risk of developing testicular cancer later in life. There may be a tendency to wait and see if the testicle will come down on its own, but the evidence shows that after 6 months, this is highly unlikely. Another issue is the difficulty in diagnosis. A careful physical exam by an experienced clinician is the most important tool. The guideline recommends against the routine use of ultrasound to locate a non-palpable testicle, as it is often unreliable and can be misleading, potentially delaying referral to a specialist. For the parents and the child, the experience of managing cryptorchidism should be a straightforward and reassuring one. The diagnosis is typically made at birth or during a well-child visit in the first few months. If the testicle has not descended by the 6-month checkup, a referral to a pediatric urologist is made. For a palpable testis in the groin, the urologist will schedule an orchiopexy. This is a common and safe outpatient procedure. The surgeon makes a small incision in the groin to find the testicle, gently brings it down into the scrotum, and secures it in a small pouch. For a non-palpable testis, the procedure begins with a diagnostic laparoscopy, a minimally invasive look inside the abdomen with a camera to locate the testicle or confirm that it is absent. If the testis is present in the abdomen, it can often be brought down in a single surgery or sometimes in a 2-stage procedure. This is a perfect example of personalized urologic care. The surgical approach is tailored to the specific anatomical location of the testicle. If it's palpable in the inguinal canal, a simple groin incision is all that's needed. If it's non-palpable, a diagnostic laparoscopy is the essential first step to determine the right course of action. This avoids unnecessary larger incisions and ensures the most efficient path to correction. The timing of the surgery is also personalized to the child's age, balancing the benefits of early intervention with the safety of anesthesia in an infant. The goal is always to perform the least invasive procedure necessary to achieve a successful and durable result. When performed by an experienced surgeon within the recommended time frame, orchiopexy is a highly effective procedure with a success rate of over 90%. It successfully moves the testicle into the scrotum, which allows for normal growth and development. Most importantly, it significantly improves fertility potential compared to a testis that remains undescended. While orchiopexy does not completely eliminate the increased risk of testicular cancer, it brings the testicle into a position where it can be easily examined, allowing for early detection if a tumor were to develop later in life. This is a critical long-term benefit for the health and well-being of the child. The future of cryptorchidism care is focused on improving our long-term understanding of fertility outcomes and on refining our diagnostic tools. We need more high-quality, long-term studies that follow men who had orchiopexy as infants to better quantify their fertility rates and to understand the precise impact of the timing of surgery. While the current guideline discourages routine ultrasound, there is ongoing research into advanced imaging techniques that might one day provide a reliable, non-invasive way to locate a non-palpable testicle, potentially streamlining the diagnostic process. I do this work because the management of cryptorchidism is a profound opportunity to protect a boy's future health and wellness. It's about more than just a simple surgical correction. It is about preserving the potential for fatherhood, reducing the risk of a future cancer, and giving parents the peace of mind that comes from knowing their child has received the best possible care. The better way is clear. It is a path of proactive, evidence-based intervention. By adhering to these guidelines and ensuring that every boy with an undescended testicle is seen by a specialist and treated in a timely manner, we can have a lifelong positive impact on his health. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.